Everybody. My name is Kimberly Cirillo. I'm a registered nurse of 31 years. I was introduced to this patch probably about a little over 2 years ago. It would have been October, November of 22. And a friend of mine introduced me to it. And I said, I'll try it. But, and he said, the first thing he said was Mark that introduced me to it. He said, let me, are you having any pain or any issues, or how are you doing? And da 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 da. So I said, yeah, actually, I am having pain. I have neck issues from a cervical disc problems that I have in my neck. And I was going to a neurologist for Botox injections because these headaches were giving me headaches every day. So I started getting Botox injections to my neck and my head. And I thought that was my only problem. And so I said, all right, well, maybe if I can come off these Botox injections and all these oral nerve pain medications, maybe that could help. So, and then I also thought, I'm a registered nurse, like maybe I could do an extra line of income if this does work. So I was kind of looking at it from both angles. So I said, all right, I'll try it. And while I'm trying it, you know what, since there's, I see all these different, improvements, I'm going to go in with the biggest pack, get the biggest pack, start a side income. And hey, there's a money back guarantee. If it doesn't work, I can always send it back. And so I was on the fence for like the whole 30 days. So little did I know that during that time, that first 4 to 6 weeks, and Mark didn't know this either, but I'd already suffered from getting COVID, already suffered with pulmonary embolus after the vaccine. Then I didn't know that my heart was failing. So while I was taking it for my nerve problems, what I didn't know is that I was also going for echocardiograms, and the cardiologist said, Kim, your heart is worse now in 2022 than it was in 2021 when you were hospitalized with blood clots in your lungs. He said, your ejection fraction is 35%, which he wanted me to start at Entresto and all these things, and my blood pressure was really low. Anyway, long story short, I didn't know. And I'd done some reading about the whole, it could help reverse your heart in 6 months, this and that. So I said, all right, I'm going to keep wearing this patch and see what happens. Meanwhile, the doctor sends me for an MRI of my heart right after the holidays. And I was like kind of poo-pooing it, but I wasn't feeling that good. I was sleeping a lot. I had this cough that, it wasn't pulmonary. It wasn't from the lungs. So it was coming from the heart. So really 6 weeks after I started wearing the patch, and I was really on the cusp of canceling this, I said, I went back and I went and did the MRI of the heart, and I was so anxious about what my results were. I went back to the hospital the very next day and got the results of that medical study. So it was a Thursday evening, and I had given Mark a hard time about this, saying like, I don't know, this and that. My neck's feeling a little bit better, but now I have this other heart issue I'm dealing with. So, and I was just very skeptical. So I was very cautious about this. So I went back to the where I got the MRI at the hospital, and I sat in their medical records room and read the report, and it said my ejection fraction was back to normal, 55% in 6 weeks. And I just couldn't believe it. And so now I had a follow-up appointment with the doctor, like, I don't know, the end of that month, end of January, but I already knew the results, but I couldn't wait for him to tell me what the results were. Anyway, so I left that office and I called Mark, told him, wow, this seems to have saved my life. Like, I'm not on Entresto. I was coming off the nerve pain medication. I did not stop taking the Botox injections for quite some time, just because I was nervous to really go cold turkey with the medication. But here I am over 2 years later, I'm now off Botox injections. I went back and had more diagnostic tests done about a year and a half. So 18 months after the MRI in my heart, would have been summer of 23, I went and had another echocardiogram done, just because I wanted to see if this was sustaining, myself, with no medications. And sure it was. And 55% ejection fraction. My heart strength was good. No medication for my heart. And really, in 2.5 years, I can go on a list of other testimonies I have for myself, my body. I had ligament issues in my leg after an injury. My leg healed without me having surgery, much to the surprise of some of my doctors. But I avoided surgery, and there were some other things that went on with me, and a lot of things that were my results. Not only could I not feel them, some of the things that I couldn't feel, I found them out, the improvements on diagnostic tests, lab work, just routine things that I would just be following up with for doctors for different things. And the doctors couldn't explain my improvements. The cardiologist couldn't explain my improvements. So of course I gave him some literature on that. And he was quite interested in how this happened, because he had never seen that before. So anyway, I'm 54 years old, a nurse of 30 something years. I nearly gave up. But something told me to just buy the biggest pack, research it in the next 30 days, wear it, and then see what happens. So, just like Mark saying all those things, I do wear it every day. I would put it on in the morning, take it off at night. So I, hydrate and electrolyte my body well during the day. And I just have great stamina, great mental focus. And yeah, it's been a lifesaver for me on a number of body systems. So, the business is taking off tremendously. So, hope to see you all soon. Thanks so much, Mark, for letting me have the opportunity to speak tonight.